Well, hello. We're here with Dr. Pakman from Hatboro in Pennsylvania. Dr. Pakman, hello.
How are you, Mr. Flash?
Very good. Dr. Pakman, you're a dentist, and there's lots of people out there who they have a bunch of missing teeth in their mouth. Not necessarily a bunch, but 2 or 3, and in the back. And frankly, they're missing for a while. 2, 3 years, more sometimes, a decade. And really nothing all that bad has happened. And yet, you dentists keep telling us we've got to replace those teeth, otherwise all hell will break loose. So, yet hell apparently hasn't broken loose. Shed some light on it, please.
Well, the truth of the matter is that when teeth are missing, there's always going to be some movement of the teeth. It may not take place right away, may not take a year or 2 years, but over a period of time, those teeth will start to shift. When they do shift, it starts to change your bite, or as we dentists call the occlusion. If this happens, this can set up a lot of different problems, causing further loss of other teeth because of too much pressure being put on those other teeth, and the dreaded temporomandibular joint dysfunction, which everybody knows as TMJ. So we really like to replace missing teeth because we know that sooner or later they're going to shift, and not in a favorable way.
Okay, so me having learned a couple of lifetimes ago machinery engineering, so when you have a door with hinges or something like that, and you use it uneven or you use one only, obviously it gets wacko and it makes all kinds of problems. So I assume that, you know, if because of it, what you're saying is that you start using your mouth in a way it is not meant to be used, use it one-sided, one way or the other way, whether you want to or not.
That's an excellent way of putting it. You actually disbalance the occlusion.
Okay, and let me ask you, what you just said, if you look at it and there's, you know, people have tensions here in the neck and even going lower than the neck and headaches, makes a lot of sense to me that if in your, you know, if you misuse your mouth, your joints here, and all kinds of stuff, that you might get this tension. So is it possible clinically that this is right or not?
Yes. Part of what you're saying is exactly true, that because the occlusion is not exactly what it should be, and we're using one side more than the other, you can then set up a problem, again with the joint, the temporomandibular joint, which will affect the head, sides of the head, down the neck, and even the shoulders and back. The other thing that can happen also is that the fact that you are missing teeth can further exaggerate or exacerbate an existing TMJ problem, for instance, clenching or grinding our teeth. So this will lead to further damage, yeah.
So that's all not good. So basically it's more than just chewing your food good, which in itself, as a child, my mom used to tell me, my wife tells me now, chew your food, because I go,
yes.
well.
Yes.
And so it's more than just that, which is bad enough, but it's like little headaches, little, muscle pains, and obviously headaches and tension in the head. Well, that couldn't be too good, could it?
No, not at all.
So if people have headaches, muscle tensions, and they don't get rid of it, even despite the fact they might have been at a chiropractor and they might have done a few little things, is it wise for them to visit a dentist and see what's going on, that maybe there's something going on with their mouth?
Absolutely. Absolutely. Because many, many times those headaches, neck aches, shoulder aches are related to dental problems. And what they're generally related to are what we call parafunctional habits. Parafunctional habits are clenching and grinding.
And that in itself causes, of course, in itself problems. The grinding. What problem does the grinding really cause?
Well, basically what it's doing is it's acting to loosen our teeth in the sockets that they exist in. Our teeth sit in bone, they're surrounded by the bone and the gum, and there's a thing that we call the periodontal ligament that goes around the end of the root. It completely encloses the root. By constantly putting pressure on this, it can lead to the breakdown of that ligament and further periodontal or gum problems. as well as broken teeth, cracked teeth, broken teeth, things like that.
Well, all right. Is there anything more you'd like to add to that subject, or do you think we pretty much covered it?
I think we pretty much covered it, trying to keep it simple and easy to understand.
So one should replace its missing teeth, and probably better even do things which make them not coming out in the first place, right?
Yes, absolutely. It's better to preserve them than to have to replace them.
Thanks a lot, Doctor. Bye-bye.
You're welcome.